It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, a Purdue University researcher is taking the power of augmented reality to the battlefield. Business of Health reporter Kylie Valletta tells us how the project could save lives. Kylie.
Thank you, Gary. When soldiers are seriously wounded in battle and their injuries are beyond military medics' expertise, they often need to be airlifted or transported to the closest medical facility, typically taking several hours. Dr. Juan Vox is an associate professor in the School of Industrial Engineering at Purdue. He joins me now to tell us about his technology that will help treat soldiers immediately after they're injured. Welcome to the show.
Welcome. How are you doing?
I'm fantastic. Thank you for being here. The project is called STAR, System for Telementoring with Augmented Reality. So it involves a mentor, say a surgeon in a remote location, and the medic in the field. And then tell us how your technology takes over from there.
So the idea is to have experts that convey expertise, knowledge to the medic. That could be in a rural setting or in the battlefield. What is going on is basically medics wear these see-through displays, these glasses with cameras that capture the views of the casualties. And those views are sent directly to the expert, to surgeon at the say a trauma hospital like the one in Indianapolis, IU School of Medicine. The experts look at these images in a large interaction table. They discuss the cases, they perform annotations, they move their hands, they put surgical instruments, virtual instruments, real instruments. Those instruments and annotations are sent back to the medic, and the medic can see these virtual instruments combined with the reality, with the view of the patient at the same time, and can operate following the instructions that he's receiving from the experts.
And this is all, they can communicate, talk back and forth, and this is all live, real time.
This is all working in real time. We try even communication from Indianapolis with Virginia, with Norfolk naval bases, and the communication worked great.
And beyond the military application, you're also working with Purdue to commercialize the technology, perhaps for rural application.
Right. In rural application, there is a serious need for this type of technology because oftentimes they don't have the surgical expertise required given a case that requires some type of procedure, and they need to bring this expertise, and the best way to do that is remotely. So as opposed to previous attempts where the communication was only audio through speech, we're actually bringing images and annotations and videos that experts can in real time use to interact with the medics, with clinicians, with whoever is actually providing the care.
And also disaster relief.
Disaster relief is very important because in those situations you may need urgent assistance, and sometimes the first responders are the people arriving to the place and required to give treatment immediately. Sometimes the procedures could be pretty simple, like cracks, opening the airways for the patient to breathe, but without the required knowledge and training and instructions, those patients may not remain alive. So we have this ability of providing real-time assistance through video, through instructions and verbal commands to the location, and provide assistance in this way.
Well, it's a fascinating technology, and I certainly hope that it's in the field soon. Thank you for being here.
Thank you so much.
Gary, back to you.